Good. So guys, we are waiting here outside for acupuncture.
Yeah.
So next week, which number?
You are 7.
7.
Yeah.
So it's still not start.
It's fine.
Okay. So
Random.
okay. Number. Okay, guys. Okay, waiting. Guys, we are just waiting here. So after doctor come here, I need to lay down here and start our acupuncture. So just waiting.
好，我们先take a seat over here.
I need to lay down.
You have to relax. I check your phone. First you have to cross your arm. Left side feel a little pain, right? Just a little.
Yeah.
But right side,
No pain.
no, a little and no pain.
Yeah.
The rib over here has some problem, so we have to put it in the right side.
Okay.
Now you have to totally relax, and now you can lie down. Okay, take it easy. Okay, and put your hands behind the neck, and go so in. And totally relax. Now inhale the air, and then exhale the air. You hear the sound?
Yeah, it's good.
Okay, relax. Now, how do you feel now? Different?
Yeah, it's
okay. That's your shoulders problem. You should have so many problems. So your elbow here will feel pain.
Yeah.
Later we have to acupuncture over here.
Okay.
我觉得我去开个图给他看，这样子比较明了。
好啊，好啊，
我找个图来给他看。
It's really good. It's totally change.
Let me explain to you. You can see this is your muscle, and we can see inside we have a tau band, and tau band is caused by the nodule. And we can see the nodule. This is also muscle fiber, and this is some problems muscle fiber. The muscle fiber will contraction and will become a nodule, and he could not really relax. So we have to acupuncture over here. You can see the picture. We use the needle. This needle called dry needle because no body injection, just needle put in the muscle fiber. And if this nodule relax, the muscle, you can feel the muscle fiber is twitch. Yeah, that's later we will do. Okay. Now we can lie down on the bed.
Straight or
Face up.
face up?
Yeah. And pillows over here.
Shoes?
It's okay. I think it's okay. And you say here, right?
Yeah.
Okay. And here, right? So how many times do you play volleyball a week?
Not too much.
Not too much.
Yeah.
So which country you from?
Pakistan.
Oh, okay.
Yeah.
巴基斯坦。
Cool. It's on the both side, both like an
Oh, both sides.
yeah,
Oh,
both
okay,
same
okay, okay.
thing.
他也是中国医的学生，
哦，OK，
硕士生。
硕士哦。哇，跑来这边了。
嗯，
If you feel too pain, please let me know. Okay.
Okay.
You can feel the muscle is jumping, right?
Yeah.
Are you okay?
Yeah, yeah, yeah.
Okay.
Don't worry.
So how tall are you?
5'10".
5'10".
Yeah.
And weight?
Weight 90.
Okay. Oh, so people in your country are very high, right?
Yeah, mostly are top.
Uh-huh. Are you okay?
Yeah, yeah.
这个是手的部分，然后再来我们看看脚的。Very soreness, right?
Good.
YouTuber 的频
对
道。
对对，
酷。
Let's start.
有在经营。
哦。
How many people subscribe?
1.5.
1.5.
1,500.
Oh, okay. So how long have you been to Taiwan?
2 years almost.
Oh, 2 years. Oh, oh. So you can graduate this year, right?
Yeah.
Oh. And then go back to Pakistan.
Not yet.
Not yet.
Not.
Stay in Taiwan.
Yeah.
For PhD.
For PhD, another 5 or 7 years.
Yeah.
So you have a girlfriend in Taiwan?
Not yet.
要帮他介绍。
好啊，可以啊。有吗？
要看他的菜是什么。
嗯。Doctor will.
What kind of girl you like?
Simple girl.
比较朴素的。
哦，朴素的。哦，OK。
Doctor will introduce some girls for you.
Muslim or 需要是回教吗？Muslim， 对对对。
The girl will be Muslim or not?
I will convert her later.
所以他们应该都回教嘛？
对。
对。So you have to pray every day and cannot eat pork, right?
Yeah.
Oh.
5 times.
啊，太可惜了，台湾猪肉那么好吃。But pork in Taiwan is very delicious.
Yeah, maybe. I know, I try. For me, the smell is pork, not good. Oh. That's good.
You can feel the muscle jumping, right?
That's good.
耶路撒冷的英文怎么讲啊？
我不晓得。
这里离耶路撒冷很冷，那个阿拉看不到，他在吃猪肉，可以偷吃。
那很虔诚。
哎，卖家啦，卖家啦，对啊。
No the location，卖家。
卖家 is your，哇，我不知道怎么讲英文。
Masjid.
Oh, masjid.
Yeah.
Yeah. Your guy is from that, right?
Yeah. It's not specific.
Oh.
It's just like a home, not a.
Oh, okay. 想说台湾离那个很远，
搞不到。
对 ，OK， 好，先这样子好，然后回去可能要帮我跟他解释一下，因为肌肉跳完那个乳酸会放出来，会蛮酸的。这2天会酸。
Guys, it's just finished and little bit blood here. And it's good. It's not too much painful. I thought. And my friend is just still there to help. little bit flat. It's good. Good experience. So guys, we just finished it. It's very good experience. I thought it's really little bit painful, but no, it's not painful, and the muscle get relaxed. And the bipolar adjustment is also very good. Hope you enjoyed this video. See you in next video. Bye.